guys lost points on last week's assignment, I'll leave it up here for you. You can grab it on your way out. The athletic trainer resume was probably because you didn't mention anything about any sort of athletic training degree, like a master's or a PhD, or you didn't mention any athletic training experience. So I was looking for those two things. And most of all, there were like 3 letters of recommendation from the president, and letters from football players, and Dave Lincoln, curing cancer. It was just hilarious. Anyway, I'll send those out. You can grab them on your way out. Make sure to sign the thank you note as it comes around. And I will turn it over to today's speaker. Thanks for coming.
All right, thanks guys for coming. I'm Christine. I know how hard it is to come to a 4 o'clock class on a nice day, so thanks for being here. So I'm a physical therapist, and so physical therapist is, we specialize in the skeletal system, the muscular system, and also in movement. I would say that we're the experts in the medical field in those areas. So we're often referred to as physical torturers or personal terrorists by our patients a lot of the times, but not always. And also, so we're not massage therapists either. So there's definitely a distinguishing between those two. Although we do some massage therapy, some manual therapy is what it's called more than massage therapy. So I'm going to start off with the education requirements to apply to a physical therapy school. So it varies by the institution that you're going to choose, but there is now a centralized application service that helps kind of standardize it so that you're having to do the same work over and over for each school. You need typically though a bachelor's degree, and there's several prerequisite classes that you also have to have. Then you take your GRE. You have to have a certain number of observation hours, and that definitely varies per school as well. And it's nice to have observation hours in the different areas of where you can practice physical therapy, like in a hospital setting, an outpatient setting, and maybe like a nursing home. And then also you have to have letters of recommendation as well. Often one of those has to come from a physical therapist, and then you need like a personal one, and probably one from an academic, like a professor or something too. So also I wanted to just talk about a few things that would make you a good physical therapist. So definitely working well with people. You spend a lot of time with your patients. You spend a lot more time with your patients than doctors do. We also touch our patients a lot. So those dang basketball players. Being comfortable touching people. Some people just aren't comfortable touching other people. Physical therapy is probably not for you if that's the case. Also, working in a team environment is huge as well. As a physical therapist, you work in a rehab team often, where there's also like an occupational therapist, a physiatrist, a neurologist, an orthopedist. So you have to work together, and you also have to work together with your other physical therapists in your department as well often. And just makes your job much more enjoyable. Being professional, we work with, it's a very professional industry. And then also, I think probably some of the most important things is being a caring person, empathetic, that you understand people are having pain and you want to help them, and then also being patient, because things don't typically happen as fast as you want them to or as the patient wants them to. And then lastly, definitely a motivator. People are in pain when you see them, or they're lazy, or they're just have a bad attitude, and you have to really motivate them to buy into physical therapy, often to help them get better. All right, so it is pretty competitive now. It's been competitive, but last year I looked at the U of M, University of Montana stats. A little over 500 applicants for a class of just 32. The program is now called the Doctor of Physical Therapy. It used to be a master's program. So the master's program was just 2 years. Now they've changed it to a 3-year program. So it's a Doctor of Physical Therapy. And why they changed that is in Montana and most of the states in the US now, somebody can come to me for an evaluation without having a prescription from a doctor. So they wanted to give us the tools to be able to evaluate a patient who comes in for back pain knowing that it's caused by a muscle strain and not from cancer. They want us to be able to make sure we can do vital signs and make sure that we're not missing something really big if they come right to us. So they added that third year of school where you get a lot more of that primary care type of experience and education. It's also nice too because you get to do a little bit more clinical work too in the in the clinics that you go to. So with the 3-year program, a lot of it's classwork, and then also the clinical internships. So you're choosing usually just like 4 or 5 internships that you take break from school, and you go out to different clinics, and you can go pretty much anywhere that they have a clinical site set up, which is really fun. And you can go travel with a team, you can do it in like a hospital, and that's really where you learn a lot of your education with physical therapy, just getting into the clinic and learning. And then after you graduate from your program, you take a test to get licensed, and that test is usually state specific, and it's a very hard test. My cholesterol spiked like 100 points during that week that I had to take my test, but thankfully I passed. So looking for jobs in physical therapy, there's a high demand for physical therapists. It's a really good field to go into as far as getting a job when you get out of school. And jobs are available almost anywhere, rural Montana to New York City. There's usually a need for a physical therapist. And then the job security. We make money when we treat patients. Like nurses, they don't really make money. They can't charge for stuff. But as a physical therapist, you can. And so your job is pretty secure if you're doing good productivity. And also, you can also create your own clinic. You can go out and open your own physical therapy clinic and be independent too. So a staff physical therapist, which is what I am, varies between working like 20 to 40 hours per week. They also have what we call per diem hours, where they kind of call you as an on-needed basis. Like, a therapist is going to be out for 3 months on maternity leave. You're going to call that per diem therapist to come in and cover for you. Schedules vary between Monday through Friday, but there's also weekend coverage that's often needed, especially in hospitals where patients are still getting sick on Saturday, Sunday, and Christmas. So often there still has to be a therapist that covers those types of things too. But it's pretty variable. If you don't ever want to work weekends, you always work in an outpatient clinic. If you don't mind working weekends, then the hospital might be a setting for you. Salary for a staff PT, and it varies definitely by education, or not education, experience, and probably what area you're working in, between $45,000 and $80,000 a year. So it's comfortable, especially for Montana, for a fairly good living. So my journey to becoming a physical therapist, I was an athlete in high school and I played volleyball here at Rocky. And when I first came to Rocky, I had no idea what I wanted to do. And then I suffered, through high school, you sprain your ankles a lot. And my mom has a rare type of arthritis, so she was always in pain. And I'm always like, oh, how can I help you? And I never really had the tools to do that. And I had a really bad shoulder injury when I was playing here at Rocky, and I had to go through a lot of physical therapy myself. And then also I enjoyed exercising. I enjoyed teaching people how to exercise, as well as I just enjoyed being around people. So then I graduated from here at Rocky with a biology major and then a chemistry minor. I know nothing about chemistry. I don't know how I managed that. Don't really use a lot of chemistry in physical therapy. And I definitely knew that I wanted to pursue a medical field career. So I took off like a year and went work construction. I worked at the lab at the Billings Clinic, and I'm like, oh, I need to find a real job. So I decided to apply to PT school, and I was pretty intimidated because I knew it was competitive to get in. But I applied and got in. And then I graduated in 2006, took my test, and I've been employed at the Billings Clinic, orthopedics and sports medicine ever since. So this is our gym down at the clinic. Lots of exercise equipment. There's some tables in the background, if you can see them, where we have patients lay down and we treat them there. So just to kind of give you a picture of what a day looks like for a physical therapist in a setting that I work in. So I work in an outpatient physical therapy clinic. So the patient walks into the clinic, they're able to get there by themselves. Usually there's a schedule. So I show up and there's a list of patients on my schedule, anywhere from like 45 minutes apart to half hour apart, depending on how busy we are. And the type of patients that we see at the clinic are like a 64-year-old male with rotator cuff repair who is 4 weeks out from his surgery. And usually I see those patients like once a week, so you get to know them pretty well. And lots of hands-on things, stretching their shoulder and then taking through exercise progression. And then often we see like a 14-year-old female with knee pain. And I really enjoy seeing patients with lower extremity, leg issues. In physical therapy, we do a lot of biomechanical analysis, and you can use different computer programs, you can use video, still shots to analyze like their gait, their pitching form, their hitting form if you're a volleyball player. So it's really interesting to kind of look at how they're doing their skill, and if they're having pain, what's going on with their like shoulder blade musculature if they're a thrower. I mean, how is it being dysfunctional? And then trying to figure out the right exercises to make them do their sport better without pain. So that's a really fun way to do it. Especially young people really respond really well if you get to them pretty early. So that's really exciting to do. But we use like Dartfish as one of the computer programs, which is really neat. It's a biomechanical analysis program. So there's some tech stuff involved with it if you want to. Then also we see like a 59-year-old male with neck pain from a motor vehicle accident. So a whole different type of patient. They're in a lot of pain. They have a horrible attitude a lot of the time because they were the victim of the circumstance, and so that's a lot harder patient sometimes to deal with. And so you do have that. You have some really fun patients. You have some really patients that are really hard as well. But most of the patients you see like once or twice a week on a 4 to 6 week basis, so you get to know people a lot, and that makes the job really fun if they're decent to hang out with. So this is a sign that we have up at our clinic. It only works if you work. So this kind of goes back to being a good motivator for people and enjoying seeing somebody start from here and getting them to here. It's really fun to be that person that helps them get somewhere. They come in with pain and you teach them the tools to exercise, you help them stretch or whatever you're doing, educating them on things and to help them succeed. But it's really a lot about motivating them and getting them to buy into the fact that you have to do the work. And that's not easy to do a lot of the time, but it's worthwhile and really rewarding once you do. All right, so no job is perfect with out there. Physical therapy, you have a lot of paperwork. You have to document every time you see a patient, and with our laws, regulations changing, you have to be more and more detailed. Insurance companies are paying for fewer things. You have to be super detailed with your paperwork, and that's at the end of the day when you've seen patients all day long, you're sick of talking, and then you have to go sit down for an hour and talk into your dictaphone. That's one of the hardest parts. And then dealing, like I said, with difficult patients earlier, when if you're having a bad day, because you're up all night with your sick kids, you go to work and you've got this patient that's just complaining and they're just dramatic, and it's like you just don't want to listen, but you kind of have to. So you can't go shut yourself. If you had an office job, go shut the door, hide away if you had a bad night or whatever. You have to be professional and try to put on your best face for them. So with the changing regulation laws and insurance issues, having to deal with that, and I'm lucky at the clinic, there's people that deal with that for me. If you were an independent practice, you would have to keep on top of that a lot. So that would be really challenging as well. You have to work holidays often, weekends, and sometimes you have to be on call, once again, depending on the area that you're trying to go into. And my care meter sometimes is 0. You've just cared for people all day long, and it's just kind of be exhausting to continue to care for one more person. But most of the time, I love my job. I really feel like it was the perfect fit for me. I didn't know I wanted to do physical therapy until I'd already graduated from school from Rocky, and I'm so glad that I chose to do it. What's nice about my job is our patient population is very variable. So I can see a 10-year-old girl, I can see somebody who's almost 100. And you're seeing everybody in between and all different types of injuries. I work with a really great team. Our office is like a locker room, a lot of ex-athletes, and it's just it's really fun to go to work. It's also, you've learned some really great skills to use outside of work. So if you're at a party and somebody's like, oh, my elbow hurts right here, what can I do about it? I'm always showing people stretches, or I'm like in the middle of a party or like laying down, having people do stretches on the floor to show them or whatever. So it's nice to have those skills. You can help your family and friends recover from simple injuries. And And the flexibility is really great. So I have 3 little kids, and I've been able to continue to work. I've switched from a 40-hour week to a 32-hour week, and my jobs, they're really flexible with me, but like I was talking before, you can work per diem, you can work part-time. I mean, the job market is so they really need therapists, so they're willing to take with whatever you can usually give them. So it's really flexible. A couple other ways that it's flexible is you can work with different areas of physical therapy. So I work with orthopedics. So that's like somebody who has a total knee, an athlete that has a shoulder injury, somebody who sprained their ankle. There's also like working with pediatrics with kids. So kids that have CP, cerebral palsy, or babies that are like 3 months old in the NICU that are failing to thrive because their mothers were using meth during their pregnancy. I mean, there's a big variability with the pediatric population. I almost went into pediatrics, but it was difficult for me to think that some of the kids are never ever going to get well. They're always going to have these constant changing things. So, but they're really fun to work with, and they're so tough. The kids are really fun to work with. So I work in orthopedics, like I said, with like total knees, hips, back pain, neck pain, lots of those things. And also in other areas like with stroke or head injury. So that's a whole different realm. Those people have a massive stroke. Basically, they wake up and let's say they have a left-sided stroke. They have no strength of their left arm, left leg. They wake up like that and they can't speak. I mean, what a horrible thing to have happen. So they go to the emergency room, they get admitted to the hospital, and they have these big workups to figure out what's going on. Okay, they figure out they had a stroke. So the physical therapist comes in like that day or the next day, and we have to figure out a way to get them up. Have to get them on their feet or get them at least sitting at the edge of the beds, because some people can't even sit at the edge of the bed when they've had a major stroke. Some people can hardly open their eyes. So we have these really intense situations that you're going to with that type of person, but those jobs are so rewarding with working that population, because you're really taking somebody that is just feel like they are dying, really, because they can't move, and gradually working them back. So those types of patients will end up, after they leave like the hospital setting, go into like what we call rehab. So rehab is you go and you stay there, you don't leave, and you have therapy like 3 hours a day, and it's really intensive. You're getting other therapies as well when you're there for like head injuries. People have their mental status is way off. So they're having to have speech therapy, occupational therapy, which is using more of the hands and manipulating buttons and just simple things like trying to open a door again. It's a lot of training. So and I don't do a lot of that, but it's very, very interesting. And there's so many advances in neurology right now, so it's a really interesting field to work in. And then with sports, so specifically, you can. I've known some therapists that will travel with like the PGA golf tour. They'll work with professional teams, or they'll work just for one specific professional athlete too. So those jobs are pretty far and few between, but it's definitely an option out there too. So the other thing with the flexibility is not just the type of therapy that you're treating, but also the different areas. So acute in the hospital, so that's when you go to the emergency room and you first get admitted to the hospital. That's acute therapy. So we're getting you up for the first time. Outpatient, that's where I work. People walk into the clinic and they kind of be seen once or twice a week. And there's home health. So that's for people who can't leave their home. I've never worked home health, but I think I've heard it's fun, but also it's quite scary walking into some people's houses too. So the rehab or nursing homes, that's where I talked about you go and you stay for several weeks sometime trying to rehab to get strong enough so that you can go home. And typically the rehab and nursing home and the acute care, those areas are more in high demand. It's a little bit tougher work and it's hard to keep therapists there, so they will usually pay more. Often you'll get signing bonuses, especially if you go to a rural area that is harder to find a therapist in that area. You'll get a signing bonus, you'll get paid a little bit more too. So I talked about traveling with a sports team. Then there you can travel too. So you can work for a travel agent, not travel agency, but a company that hires these different therapists, and they send you at like 6-month stints to Georgia, and then the next 6 months you go to California. So that's kind of neat too. If you don't have anything tying you down, you can travel around and you make really good money. They pay for your travel expenses, your living expenses, and plus they pay your salary too. And then also occupational health. So that deals with if you're injured at work. You'll see a therapist in occupational health. And also occupational health, they work with people, like if you're having neck or back pain and you sit in an office cubicle all day, they'll come into your office and say, oh, your chair is not high enough, your screen needs to be tilted up on your computer, you need some armrests for your chair. You know, and those are the things that help people have less pain while they're working. So. All right, so as I said, I love my job, and my biggest reason is because of my patients. So I had just had a patient leave me a thank you note, and she said, I feel so blessed to have had you. I know I'm doing better because of you and your knowledge. I won't regularly, I'm not bragging, but you know, you regularly get thank yous, people drop off gift cards, and they're just really appreciative of helping people, of you helping them. So that's my favorite part of the job, and working with these young athletes and seeing them come in just completely distraught that they can't play this basketball season and they can hardly walk and put weight on their leg, and you help them kind of battle back and get to the point where they're playing again. It's really rewarding. It's really fun. All right, so I talked pretty fast, but questions? Yeah.
Do you ever have patients with fibromyalgia?
Mm-hmm. Yep, we see that. I think at first when the diagnosis came out, it was pretty over-diagnosed, but there's definitely people that I've seen with fibromyalgia that definitely have it. It's just a connective tissue nerve disease that's just very painful for people to move. And so it's definitely, we often see that with other injuries too, so it makes it a little bit more complicated. But yep, definitely. Has anybody here had physical therapy? Okay. Was it a good experience or a bad experience? Good. Did you like your therapist as a person? And that's what kind of took me into it too, is every therapist I met, I liked them. I'm like, well, if you like them, why wouldn't you want to work with somebody like that? And I want to kind of be like that type of person too. So that was good. Yeah.
How many grad schools did you apply to and get accepted to?
I just applied to 2. I did University of Montana and then Regis in Colorado. And things, I got into both, but I chose obviously Missoula because it's so much cheaper to do in-state. If you can do in-state, that's my best advice, do it. Who cares if it's in Alaska or Montana? I mean, it saves you thousands, and I'm still paying on my loans, and it sucks. So go the cheaper route if you can. Missoula's a great school. They're really anatomy-based, and as far as advice for you guys as undergrad students, gosh, your anatomy class is so important. And just challenging yourself to learn all that in detail. I use my anatomy every single day, every patient. And also, I wish when I was at Rocky I would have taken like kinesiology. And I also wish that I could have maybe done some more athletic training background, just because you get to get more patient care earlier on if you were to do more athletic training. And the standards for athletic training have changed since I was in school. But, as much as you can be around patients in general, even if it's, just your student athletes, and being involved with the kinesiology, I really enjoyed biochemistry. Physics is really important too, so you learn about all the levers, and those are all really good classes to have. Okay, anything else? Anything else, Holly, that you want me to talk about?
What do you think set you apart from the other applicants when you were applying?
I think having my biology degree was good. I didn't have a great grade point. I had like a 3.6. And I don't know if my personal experiences were good. I grew up in a small town, and I think that I really showed that I was a hard worker. Like I said, I worked construction the summer after I graduated from Rocky, and it was the most horrible experience, but I stuck with it for like 4 months. And just things like that. I think, because in school it's hard, and they want to have students that are not going to give up and they're going to continue to try, and it's like that in the work place too. So I think I proved that I was a hard worker, and I'm a team worker. Playing in sports my whole life. I think that was really big too.
How many observation hours and job shadowing did you do before you got accepted?
Gosh, I know it's been a long time, so I can't really remember exactly, but it was just reviewing the U of M stats or thing for that, and they said 90 hours. and they require it in 3 different places. So it would be like with me in like an outpatient setting, and then you'd want to go to like acute care, and then maybe to like a nursing home to observe. And I think that's, I mean, especially as you guys as freshmen or sophomores or whatever you're at, wherever you're at, just kind of getting in there and seeing if you like it. I knew I wanted to do a medical career when I was a freshman or sophomore, but I didn't have a clue of what I wanted. I knew I didn't want to do a doctor because it was way too much work, and I knew I wanted to have a family, so I knew that would have been hard. But I think if I would have, gone through a class like this, it would have been helpful, or, just getting into the clinic and seeing what the different disciplines do is really important too. And then trying to even volunteer or just do like a small internship. I know we have lots of students from Rocky right now doing some internships, like we're kind of even full right now for accepting students. But, even during the summer, if you're here, over Christmas break or whatever, we're always trying to take students just to see what it's like.
What do your student interns do?
So we have that schedule of patients, so we'll grab our 8 o'clock patient, and if it's an evaluation I'm doing, they basically observe most of the time. And after we get done treating the patient, we sit and talk about what happened with the patient, do some clinical reasoning, and often we have the student try some of the exercises that we're doing so they can see how they feel, so you kind of get an idea what the patient's going through too. But it gives you good perspective as well. And then we can do case studies. If you wanted to do something, you can choose a patient and you can kind of follow them through if you wanted, or we're pretty flexible. So just whatever to get a good experience and kind of get a taste of what it looks like. But I think therapy it's a great field, especially if you want to have a family or you want to be flexible, and you can change jobs. Like let's say I get sick of doing orthopedics, I can go to the nursing home and start treating stroke patients if I want. It was kind of scary for me because I haven't done that training in like 10 years. But if your job, you can think about something you want to do for 30 or 40 years. And I can see myself never leaving my job right now. I love it. But if I wanted to, or if I knew that I only could work 10 hours a week, there's probably a job that I could find. I have recruiters calling me probably once every 2 weeks trying to fill jobs just here in Billings. So there's a really good job market, which is hard in biology. I mean, sometimes just a general biology, what are you going to do with that? To pay back your loans. So it's nice to have a really good skill set to use. Okay. Anything else that wasn't clear that you have to write for your resume or anything that I can help with? Okay. Okay.
Your slide about different locations they can work at.
Sure. This one?
Alright, so your assignment is going to be on this. Pick one of these places to be